Thank you for tuning in. You're watching COVID-19 and I'm Min Sun-hee. The number of new infections on this Thursday here in Korea has dropped below 200 for the first time in roughly about 2 weeks. Authorities, however, remain cautious given the growing presence of asymptomatic patients as well as cases that have yet to be traced. Here now are the latest numbers on the pandemic worldwide with our Kwon So-ah. So let's begin with the situation here in Korea.
Yes, Sunny. Well, Korea reported the lowest number of coronavirus cases since August 17th, when the single-day caseload was 197. And as of this Thursday, 12 a.m., it stands at 195. So we are below 200 now, but triple-digit figures have been reported every day for 3 weeks. And if we go over to our graph now, we do see, however, that there's been an improvement, as just last Thursday was the day when we had cases surged to the 400s, and we are seeing a gradual improvement now.
So as I mentioned at the start, despite the drop in daily cases, there has been a relentless rise in the number of patients in critical condition.
Exactly. I mean, I've been saying this numerous times this week, but we've been seeing another uptick in cases of patients in critical or severe condition, now standing at a record 154 cases. So this is really concerned because that is a jump by around 30 from yesterday. And also, in mid-August, we had single-digit figures here, so this number is increasing, and that's also why we are seeing a rising number of fatalities. In fact, this Thursday, we are seeing 3 more fatalities. If we go over to our numbers now, 3 fatalities with 329 in total, and meanwhile, 19 more people in quarantine and 173 new recoveries, and the total accumulation stands at 20,644. Now let's move over to our map. Most cases again in the metropolitan region, with 69 in the capital Seoul, followed by 64 in Gyeonggi-do province and 16 in Incheon. And those in Seoul and Gyeonggi-do province were all domestic infections this Thursday. It is a good sign that in the rest of the nation, we do not see double digits this Thursday, but there is a concern here in Chungcheongnam-do province. 7 cases we're seeing right now, but this number is expected to rise on Friday due to a new outbreak at a kimchi factory there. Meanwhile, imported cases dropped to the single digits at 7 this Thursday. And speaking of cases from abroad, let's take a look at the international figures now. The total figure stands at almost 26.2 million in total, with some 867,000 fatalities and 18.4 million recoveries. And let's move over to the highest infections around the world, almost 6.3 million in the US, and Brazil has hit the 4 million mark in total cases, while India added over 80,000 cases in just a day. But I should note that India has been conducting more tests recently. Meanwhile, Colombia at 633,000 cases has surpassed South Africa, which now has around 630,000 cases if we move over to South Africa here. And South Korea, meanwhile, has the 73rd highest number of infections around the world, while neighboring Japan has the 44th highest figure, and with some 69,000 total cases. And that is a country Sunny will now connect to, and I'll be back here with more after the afternoon briefing. Sunny?
All right, so thank you for that. I'll see you later. Right, still on the international front, neighboring Japan is striving to contain COVID-19 amid a vacuum in leadership, given Prime Minister Shinzo Abe's abrupt resignation last week, citing health reasons. I have Hiroaki Wada, a senior writer at Mainichi Shimbun, live on the line. Good to see you again, Hiroaki.
Thank you for having me, Sunny.
Hiroaki, let's begin with Mr. Abe's resignation. Was it an anticipated announcement among those in the media? And what is officially known about his health at the moment?
Well, he just had a press conference a couple of days ago explaining why he's stepping down, and he said that it's because of his chronic condition in his intestine, in his colon, which forced his resignation some 13 years ago when he had the first administration. But his condition obviously is stable, because he said that he's going to stay at the helm until his successor is selected, which is going to happen sometime later in this month. So although he said he is going to step down, but he seems to be okay in terms of his health, and he does serve as a prime minister.
Hiroaki, there are those who claim that the resignation comes in response to the administration's failure to contain COVID-19. What are your thoughts on this?
Well, his opinion poll numbers are going down in recent months, especially after the onset of COVID-19. And those polls also show that people didn't like the way he handled the issue. The number was like 60% people saying no to the way the government is taking care of people against the disease. But I'm not really sure if he was very worried about those numbers, because he didn't really show up to the public. The resignation press conference he had at the Prime Minister's residence was the first one he had in 2.5 months. And I'm talking about the press conference held at the Prime Minister's official residence. He did talk to reporters here and there, but it was not official conference. So if he was really worried about his reputation, he should have come out much oftener and explain why he was doing this and that. But he didn't do that. So there are a number of speculations as to why he quit. He said he is quit, but they're just speculations. Some people say that he said so because he broke the historical record of Prime Minister serving, and he served for 7 and 8 months, which is the longest. So he had some record, and that's why he stepped down, some people say.
Hiroaki, when exactly will the new Prime Minister come into office then?
Well, the ruling Liberal Democratic Party will select his successor as the president, and already there are 3 people saying they are going to run. The vote will be held on September 14th, according to the LDP. But it seems like the winner is already fixed because he has succeeded in garnering the support of major factions within the party. And the expected winner is Chief Cabinet Secretary Suga, who is the top government spokesperson. And there are 2 other contenders, former Foreign Minister Kishida and former LDP Secretary General Ishiba, but they don't seem to have chances according to observation by political watchers.
Hiroaki, let's turn our attention to the pandemic then. Daily cases in Japan appear to be declining compared to about 2 weeks ago when the infections hit about 1,000 cases a day. Please do tell us more about the situation there.
Yeah, yesterday's number of new cases was something like 600, which is quite lower compared to, say, early July. So some people are saying that maybe we are seeing an end of the second wave of the COVID-19 infections here in Japan. But one factor we are worried about is the slight increase in the number of serious cases. And those people tend to be older compared to earlier days. And that means that doctors and nurses need more time to help them recover, and they will require more expensive equipment. And experts are worried that if this trend continues, Japan's medical system might be under strong pressure. And so people are watching very closely how those serious cases will develop.
Right, severe cases is also a concern here in Korea. Hiroaki, I understand authorities there are also considering free COVID-19 vaccines for all its people. Could you tell us a bit more about that?
Right. And the government is expected to make some kind of decision sometime this week about this free vaccination. They want to give the virus to everyone who wants to get the shot here in Japan, but the initial supply is expected to be limited. So the first groups of people who would receive the vaccination would be like doctors, nurses, critical workers, and elderly who would develop severe symptoms if they get infected. And after that, if we have more supplies, then all the people who want to get shots would be compensated for the cost they would have to cover for the vaccination. That's the plan I hear so far. And they will make some kind of decision later this week.
I see. All right, Hiroaki, thank you as always for making the time to share your thoughts with us.
Thank you so much for having me. I appreciate it. Take care.
Right. We turn now to the regular afternoon briefing on COVID-19 here in Korea. While the number of new infections appears to be on a decline, authorities are keeping their guards up as the number of patients in critical condition has surged to at least 154 as of this Thursday. The number stands in sharp contrast to the 9 patients in intensive care in mid-August. There is also mounting concern over cases that have yet to be traced. According to officials, the transmission paths of 23% of all cases reported from the 20th of August to the 2nd of September, that would be yesterday, have yet to be identified. Also, yet another source of much alarm, that is the presence of asymptomatic patients. Findings show 4 out of 10 patients are not displaying any symptoms, raising fears of continued sporadic cluster infections. The briefing is about to start. We'll come back to you afterwards.
First, we have Deputy Director Kwon Junuk with the explanation. Let us now begin a regular briefing for COVID-19 response for September 3rd, Thursday. As of today midnight, we have 188 new local infections and 7 new imported cases. The total caseload now stands at 20,644. 173 more people have been fully recovered, and we have 4,786 people in quarantine. We have 154 patients with severe or critical conditions. Yesterday, we had 3 additional fatalities. And I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now look in detail at the updates of domestic infections by cluster infections. And these are the updates as of noon today. Related to the Sarang Jeil Church in Seongbuk-gu District, Seoul City, we have 22 additional cases being confirmed in total. We have 1,139 cases being confirmed to date. And as for age group, those over the age of 60 account for about 40.6%, standing at about 469. And we have identified that the further transmissions from the Sarang Jeil Church have been found at 27 venues, and 11 of them were religious circles. And also further transmissions were reported by 191 confirmed cases. And related to the Liberation Day Seoul rally, we have 21 additional cases. We have a total of 464 new cases being confirmed to date. And we have confirmed 11 venues that have been having further transmissions from the rallies. And in total, in relation to the further transmissions, we have 8 religious facilities so far. And we have 2 health clinics, and 1 office building that also have spreading infections. And in Dongjak-gu District, regarding the Ji능 Global, we have a total of 34 cases so far. And in relation to a Gangseogu District, an aviation supplier company, we have also the index case being confirmed earlier. 9 additional cases have been confirmed. In total, we have 10 confirmed cases to date. And in Seochogu District, we have the disabled education center, and also we have 7 additional cases being confirmed, and a total of 8 people have been confirmed to date. And we are conducting epidemiological investigation and contact tracing. And next, moving on to Incheon City, in relation to the Seogu City Hall, we have additional cases. A total of 17 cases have been confirmed to date. And moving on to Gyeonggi-do Province, in Gwangmyeong City, in relation to Nanum Nurito, we have 3 additional cases being confirmed. In total, we have 20 cases being confirmed to date. And in Seongnam, in relation to the BHC store in Sinin Sujin branch, we have additional of 6 cases being confirmed. And also in relation to the golf club in Gapyeong, we also have the index case, and we have 3 additional cases being confirmed. In total, we have a total of 4 cases being confirmed. And next, moving on to Chungcheongnam-do province, in relation to the Cheongyang kimchi factory, we have also additional cases of 18, and in total, 19 cases have been confirmed to date. And next, moving to Daejeon City, in relation to the Full Gospel Daejeon Uri Church, we have 4 additional cases, and in total, we have 18 cases to date. Next, in Daegu City, in relation to a sales group of health supplement products, we also have additional cases of 14, and a total of 15 cases have been confirmed to date. And moving on to Busan City, in Yeonjae-gu, we have the office telemeeting, and the first index case was identified on the 31st of August. We have 4 additional cases with a total of 5 cases to date. The KCDC continues to note that during the past 2 weeks, on-day testings was standing at about 19,300, which was about double the number of 2 weeks before. And we also had over 20,000 cases being conducted in the past several days. And during the past 2 weeks, we have seen that we have about 44.1% being related to the domestic infections, and there are about 24% cases which are untraceable. And therefore, as we see a number of cluster infections throughout the community, we are asking all of the people to get tested as swiftly as possible. And we believe that this is the most urgent. And next, let us now look at the imported cases today. Yesterday, we had a total of 7 new imported cases. As for the countries, 3 were from the U.S. In particular, the CDC would also like to note that since August 3rd, we have intensified the high-risk countries. And as for the sailors from Russia, we are having all of them to get tested of the PCR testing and to submit a PCR negative document. And among those who have submitted these PCR documents, and if they retested positive after they arrive in Korea, we also are verifying the document of the negative testing results through our foreign ministry. And starting from September, if they do not submit the PCR testing and if they submit false documents, they will be subject to a penalty as well as an imprisonment as well. And next, we have some updates on our R&D aspects. And as for the plasma therapy, we have a total of more than 2,200 people who have expressed their intentions to donate their blood, and over 1,500 people have actually completed their blood donations. And as for the people in Daegu, we have about 800 people who have expressed their intentions to donate their samples, and a total of 684 people actually donated their blood in the city of Daegu. And we would like to extend our deepest appreciation to all of them. And also, we are seeing an increase in the number of fatalities. And we have 329 death toll right now, and about 97% of them, about 300 and 20 of them had underlying illnesses. And the fatality rate for those above the age of 80 stands at 20.07%. And we have 154 symptoms, patients with severe or critical conditions, and most of them, a large portion of them, 37 of them, are over the age of 80. And we are exerting our full efforts to curb the infections spreading to the facilities that are frequented by elderly patients. And we would like to make sure that the managers of these facilities and the staff members need to take particular precautions. So we ask the managers and staff members working at these facilities to refrain from going to high-risk facilities, and also cancel or postpone travel plans or social gatherings, and get tested as soon as possible if you have suspected symptoms, and always wear face masks, and hand washing is always a must when you are at work. And also, you should also have a very restricted access to the visitors to the facilities, and also disinfect frequently touched surfaces like the frequently touched doorknobs and tables often, and also ventilate often, including while air conditioner is on. And on our safety e-report run by the Safety Ministry, major reports have been reported in relation to a golf club, and in relation to a group meal, as well as use of group saunas at these group facilities, and also in the people engaged in group sailing, and they went fishing, and they did not wear face masks, and they were in close contact environment, and they enjoyed meals. And in relation to the life quarantine measures, the government is highlighting the importance of keeping to these public guidance, and please postpone non-essential outings, social gatherings, events, or travel. If you have to step outside, please wear your face masks at all times. And if it is impossible to keep a 2-meter distance, please wear face masks even when outdoors. And you need to cover your mouth and nose completely when you wear your face mask. And please do not touch the surface of the face mask, and also comply with these measures going forward. Last but not least, we have more updates to the public. And in relation to the COVID-19 as well as today's developments, we are seeing a slight decline. While this is not a rapid decline that we have imagined earlier, however, we believe that we are witnessing some results of the intensified social distancing. And we believe that they are because of the participation by the public, as well as their vigilance and the inconveniences that have been endured by the many self-employed, as well as the sacrifice and dedication put forth by the quarantine officials as well. And we believe that after this weekend, we would believe that we would see some effects of the intensified level 2.5 social distancing. And we believe that this week, the remaining of this week, is very important, and it is actually a make or break moment. And if we succeed in curbing flattening the curve, we believe that our model and our case will be garnering international attention. However, as for respiratory diseases like COVID-19, the speed of an uptick in the number of cases is actually faster than the decline in the number of cases, and this is why we need to have endurance and perseverance as well going forward. And also, this is why it is very difficult to carry out swift tracing, and it takes a lot of time to treat people and to trace the contact and test the contact, all of those who have been into contact. And therefore, if we keep a moment of complacency, this will lead to a great limitations and restrictions in our medical capacity and increase the burden on our medical capacity. We believe that this is not yet the moment to stay complacent. It is a time for us to make sure that we need to also be fully vigilant, and the government is also exerting our full efforts to also be on alert. So for the time being, we need to wear face masks and keep social distancing and keep hand hygiene so that we can keep our on-day increase to a controllable level by the quarantine authorities as well as the medical capacity. And this needs to also decrease the number of untraceable patients. So we need to go back to the number of daily cases to mid-April or even mid-July. So this is some hope that we have right now. And right now, many of the public are showing a sense of solidarity, unity, a sense of duty, and as well as vigilance. And we believe that these participation by the public are valuable assets that we have in Korea, and we believe they are the core essence of K-quarantine. And many of the individuals are sharing their own unique way of quarantine. So people are exerting ways to utilize lunch boxes to curb the spread, to flatten the curve and contain the spread of the virus. And we believe that we will continue to exert our full efforts to make sure that we have a new habit of quarantine measures and social distancing measures as well. And as for the message, we have a message from one of our public ambassador, and this person said that the mask is the most light-weighted, however, the most effective quarantine method that we have right now. And by sharing this, we want to highlight the fact that every individuals are the proactive agents of quarantine, and the quarantine authorities will also exert our great efforts. Thank you very much.
기자님 질문에 답변 드리는 시간 갖겠습니다. 먼저 수입 기자단으로부터.
Right, that was Kwon Junuk, the Vice Head of KCDC, with Thursday's afternoon briefing. Suah, do give us a summary of his address.
Sure. Well, it looks like social distancing measures abided by the nation's people appear to be showing in the figures, as Kwon said. But he stressed that the remaining days of the week are just as important. So we still have to abide by those measures to flatten the curve. And also government officials are doing more to flatten that curve because they are conducting more tests than usual. In the past 2 weeks, on a daily average, they conducted more than 19,000 tests, and beginning September 1st, for 3 days, they are conducting more than 20,000 tests. So let's hope the figures are going to go down in the next days.
Right, let's keep our fingers crossed for that. All right, Suah, thank you for that. I'll see you again tomorrow.
Thank you.
Right, global security challenges brought on by COVID-19 were the key focus of this year's Seoul Defense Dialogue, which were held virtually for the first time for 3 days until today. Top security experts stressed the need for more global interaction amid the growing tensions between the US and China, among other issues. For more, our defense correspondent Kim Ji-yeon is here in the studio with me. Welcome, Ji-yeon.
Hello.
Ji-yeon, I hear that for the first time, the dominant theme of the event was not centered on North Korea.
That's right. The slogan for this year's Seoul Defense Dialogue is Emerging Security Challenges, overcoming these challenges through solidarity and cooperation. And the event focused on the changing dynamics of the so-called liberal international order and ways to build cooperation between nations amid the COVID-19 pandemic. And this is a major shift from previous years where the emphasis was on inter-Korean relations and challenges regarding North Korean provocations, hampering progress in denuclearization talks. In a recorded address on Tuesday, Seoul's Defense Minister Chung Kyung-do stressed the need for stronger international cooperation as the outbreak has had a considerable impact on nearly all aspects of global affairs, including security.
Despite continued efforts, the world faces concerns about a second wave of the coronavirus outbreak. So there is a dire need for unity and cooperation between nations, now more than ever.
He said the South Korean government has been sharing its know-how in disease containment with foreign military attachés in the country. It includes the early adoption of screening and preventive measures, contact tracing of confirmed patients utilizing IT technology, and the operation of residential treatment centers for asymptomatic patients or patients with mild symptoms.
Now, Chun, the event takes place at a time with very tough security challenges that have been aggravated by the pandemic, right?
That's right. And I mean, the pandemic has underscored the concept of traditional and non-traditional security challenges throughout the event. And security experts highlighted the need for the international community to better deal with borderless non-traditional security issues, particularly the global efforts to stop the spread of infectious diseases amid the struggle for hegemony between the U.S. and China. Some of the experts say such challenges have different characteristics than traditional security issues involving nuclear and conventional weapons that prevailed during the so-called liberal international order. And they seem to agree that the U.S.-led order, grounded on the norms of open market and democratic governance, has been significantly weakened, which has led to a higher risk of conventional war.
The risk of high-intensity conflict is now substantially higher than we had imagined it might have been even 5 years ago. And so, whilst we face a whole range of new security threats, which require us to think very carefully about how our armed forces can be designed and constructed to respond to those non-traditional security challenges I've mentioned, we also face a world.
You know, the experts were divided, though, on whether the competition between China and the U.S. would force other countries, particularly those in East Asia, including South Korea, to pick sides, and if choosing the wrong side could have dire consequences. Some experts say the notion of such a dichotomy is outdated, a vestige of the Cold War or other times in the past where the world faced more traditional security issues, unlike the non-traditional security issues that have emerged in more recent years.
So, Chun, what is being proposed to promote global interaction on these fronts?
Well, one of the solutions that was raised is to restore confidence in multinational organizations such as the United Nations or UN agencies, and that includes the World Health Organization, which is facing a major challenge as U.S. President Donald Trump has announced to withdraw from the global health body. And experts were unanimous in their concern that U.S. leadership on the international stage could wane further if it doesn't re-engage with multinational organizations, and called on Washington to refrain from actions that further encourage nationalism and protectionism in the COVID-19 era.
Right. All right, Chun, thank you for that coverage. Hope to see you again soon.
Me too.
많은 국민들께서 일상적인 생활을 박탈당하고 경제적인 어려움까지 가중되어 피로감과 우울감을 느끼고 계시는 것을 잘 알고 있습니다.
It's been 7 months and counting as COVID-19 continues to wreak havoc on our sense of normality. Accordingly, in today's studio session, we readdress the physical and psychological toll of the pandemic on the public. I have Dr. Yu Byung-wook from Suncheon University Hospital. Good to see you again, Dr. Yu. And I also have Dr. Won In-soo from Chaum Center. Pleasure to have you back, Dr. Won.
Hello.
Right, Dr. Yu, as I mentioned at the start of the program, the number of new infections on this Thursday has dropped below 200. Are we past the worst?
Well, the number is around less than 200, but close to 200. So I like to say just the same as like yesterday. Yesterday, some people said, oh, a little bit up than the Tuesday, so they're so afraid of that. But let me say, it's not important to see the number until less than 50, because this is kind of unexplored bomb, blind shell. So any times it can be the abrupt again, like the bumping again in the corner, because untracing is the non-symptomatic spreaders in all over the corner. So some people said, oh, now level 2.5, social distancing is work. I don't think so. Why? It just started a few days before. It's characteristic of the COVID-19. So we started level 2.5. It worked. We can see it next Wednesday. So now this is corner of the around the 200 less or more is came in reflected from the last week. So since last week, level social distance level 2 is start working, but like a small fire, I would like to say, is every springtime, early springtime, unfortunately, we have experienced a big fire in Gangwon province. Some people said, oh, big fire is gone because it's nearly finished. But because of the big winds from the west side coming, small fire uncovered finally make the big fire again. This is a similar situation, probably our dear audience, the watchers, you can understand about it. So number is not important. Anytime can be double up. So keep on the social distancing and don't care about the number until less than 30 and less than 50.
I see. So we need to continue being cautious and there is no room for complacency then.
Yeah.
Dr. Won, there are reports of a growing presence of people suffering from anxiety and depression amid the pandemic. As a psychiatrist yourself, are you actually seeing a rise in the number of such patients? And if that is the case, how severe is the situation?
Well, yes, definitely. Patients with pre-existing psychiatric conditions, not only are they reporting worsening of the symptoms, but even people that didn't have any previous mental health issues, they're actually newly developing symptoms of depression and anxiety. And such symptoms are greatly influenced by stress, and this situation itself is a major stress factor. Although anxiety is still focused on the physical threat the virus is imposing on us, it's actually the secondary effects of COVID-19, which is the economic burden, which the anxiety is concentrated on. And countless people are losing their source of income and wondering if they financially survive the situation. So, but because there isn't much we can actually do, the helplessness and hopelessness is building up and it's adding on to the depression.
Right, unfortunately. And these psychological issues, Doctor, if prolonged, can pave the path to actual physical discomforts, I understand. Could you tell us a bit more about this?
Well, somatics conditions mean who are believed and believe in the mentally is coming in all their physical. For example, so in Korean, the maxim say, their cousin have the lens, we support the stomach ache, this kind of thing. But this can be the stress related. The person who under huge stress, like now, the last grade of the high school guys, they are waiting for the SAT under stress. Only the SAT in the entrance exam for the university, but same time, on the corner of the COVID-19 makes it stress. Many the high school guys, they complain about headache and the dizzy and indigestions and lethargic and they cannot focus about their studies. It's all related, not only the directed by virus infected, but on the other hand, when we have the virus infected, inflammatory agents can going around all the part of the body on the bloodstream, especially the brain and intestines, which is producing the neurotransmitter. So we don't know still how it's working neurotransmitter, but we know that it can be affect our body still feel hurt.
I see. Dr. Won, you just mentioned the impact, the psychological impact of the situation on high schoolers. What actually is the impact on children and these students at schools following the closings of schools and the adoption of remote learning?
Right. Well, they're no longer enjoying the positive interactions between teachers and friends. And children and their families are sharing a very restricted area, the home area, and they're changing their complete daily routines. And children are supposed to attend online classes supervised by the parents, but the parents have to work as much as they can from home, or they have to go out to the office. So actually there's no one to take care of the children and supervise them. Support, which is mainly given by the grandparents, are not ready anymore because the elderly have to keep their distances. So all of this adds on to the stress, and not only the children, but each of the family members are coping with their own anxieties. So children now have increased stress and reduced resources and coping strategies. But anecdotally, in clinical practice, we see some patterns in children. A first group seem to do quite well. I mean, they're thriving on the support and structure their parents are giving them. They're actually enjoying the online classes in a quieter environment called home. But a second group is mildly negatively influenced. They seem to have less resources for online education and less interaction, so they can't practice social skills. But a third group are in families where negative interactions have increased greatly. So they're actually not experiencing getting the safe haven that was actually given from the schools.
Unfortunately. Dr. Wan, are there people who may be particularly vulnerable to the psychological strains of the pandemic?
Well, like I said, I think children and adolescents. And this is a time when the brain is actually developing continuously. Without the social interaction, biologically they can be influenced as well.
Right. Dr. Yu, another topic of great concern is that regarding the physical after effects of those who have recovered, so to speak, from COVID-19. Could you tell us a bit about this?
Well, first of all, the respiratory systems, they have a certain difficulty of the breathing, because not only directing damage by a virus infection, but secondly, many men are concerned about hair fall. So
losing hair?
Yeah, losing hair. Losing hair is kind of social disease because it can be natural but because of the hormone change. But the people are worried about the kind of losing hair. But not only losing hair, the wrinkles. The women are surprisingly have the wrinkles because they get dehydrated. They lose the sense of the skin tense, because collagen cannot synthetic well because of the protein synthetic after we are eating some, but intestinal and gastrointestinal system doesn't work well, it's falling down. But other hand is a headache, because directly it's an inflammatory agent can attack our brain barrier. They can cause a migraine or the tension headache, but unknown cause. People believe, oh, I got a stroke, but it's not stroke. Constantly can headache is already reported by after COVID-19. So it can be happen anything, but so probably we need the time to confirm the COVID-19 related as any side effect from direct virus infection. But these days they haven't reported various symptoms, but like this.
I see. Dr. Wan, I would suppose the physical after effects of the disease, such as loss of hair or lack of tension of the skin, would lead to psychological strains as well. Could you tell us more about that?
Sure. Being diagnosed with a possibly acutely life-threatening condition is a traumatic event. And whether you were just quarantined or actually hospitalized, it's still traumatic. And although people who were infected are actually victims, they felt as if people saw them as perpetrators who spread the disease. So for the long-term psychological effects, I think it would be appropriate for me to make an example for the MERS survivors. A previous study had reported over 60% of MERS survivors actually reported symptoms of post-traumatic stress disorder, anxiety, depression, and insomnia in 1 year's survival. And survivors with a history of ventilator treatment and family members who passed away from the infection, they actually showed more rates of suicidality and aggressiveness. And especially the survivors who had family members who passed away, they felt as if that they were the ones who passed on the infection. So the guilt and the grief was profound. And so therefore mental health care should be a follow-up care to the survivors.
Right. Dr. Yu, let's turn our attention now to those at the front lines of the battle against the pandemic. One study shows that at least 3 out of 10 healthcare workers are suffering from burnout syndrome. What should be done to better tackle their plight, do you think?
Well, this is inevitable because we are limited hands, but we have to do. Last weekend, I was in outdoor services for as volunteers. It was very hard, but fortunately, the lane helped to the cooling down. Many nurses, I'm so grateful to many nurses who worked so, wow, it's great. They wear the eye jackets and under the PPE, the level D, like astronauts wear, and they do work but they believe that we're doing well to support our people survive. Well, so first of all, the government and Korean Medical Association will be having the agreement to stop the striking for the young doctor group as soon as possible. And we would like to support it to the people who need our help, because we are under stress, not only the COVID-19, not only the weather, and other kind of social political press to us is make a burnout, a kind of double burnout. But I hopefully this figured out well because final beneficial for our peoples.
Right. Dr. Won, depression caused by COVID-19 appears to be leading to discontentment, which in turn, like you mentioned, appears to be displayed in acts of aggression. Could you tell us a bit more about this phenomenon and perhaps ways to better respond to it very briefly?
Right, so actually when you talk about the anger, a lot of people are doing anti-mask protests, and some are claiming wearing a mask encroaches on my civil liberties. People just don't like limitations being imposed on their behavior for such a prolonged time. They want to do what they want to do. And a threat to a person's freedom leads to something called psychological reactance, which is often accompanied with anger and the immediate desire to regain the freedom. So, and also anger and difficulty controlling your emotions is a very common symptom of depression. So if the underlying depression is alleviated, the anger that's accompanied by the depressive feelings are also relieved as well.
I see. Well, that's good to know. All right, Dr. Won, thank you very much for your thoughts. And Dr. Yu, as always, thank you for being with us today. Right, that ends our show for today. Tomorrow, we touch upon mounting concerns amid the growing presence of asymptomatic patients and those who are being reinfected. In the meantime, do take care and do abide by the tougher social distancing guidelines if you are in the metropolitan area. See you tomorrow.